Give us a little more privacy here, Megan.
Thank you.
Thank you for coming to see me today.
Thank you. It's nice to be here.
Discussing your evaluation. We're at the midterm point, and though you're a very good student, there's always room for improvement. There's areas that we can work on. Where do you think your strengths are?
Let's see. Well, I really enjoy interacting with my patients, so that's been something that's been fun for me, and it feels like a strength. So I enjoy it, and I feel like I'm pretty good at it. And I've been, any interactions where it's been difficult or any problems have arisen, I've been able to think back and talk with you a little bit about it. So I feel like I'm improving in that aspect. Gosh, the medical administrations of medicine have gone pretty well. I don't feel like there have been any mistakes, and I've been pretty prepared for that.
You've been knowledgeable of the pharmacology. Of course, you can always work on that.
Yeah, I think I could.
Enhancing that area of pharmacology, side effects, and how they specifically, the meds, relate to your patient.
Yeah, that, I can memorize it in my head. I've been going over medications in my own time, but it's always hard to remember the specifics, and then when I look at the patient and think more about how it's interacting with them and what other issues they may have, it can be challenging.
Right.
Yeah.
For example, pain medications. If your patient's on 2 or 3 different pain medications, how does the nurse decide what pain medication to administer?
Yeah, and that's all part of the critical thinking of nursing care that I didn't think I had to use all that much in my previous work, before I became a student. So it's been a challenge, but I'm enjoying it, but I think I need a lot more practice at it.
Good. You mentioned your interaction with the patient. What about with the family, too? That's really important.
Yeah, I think I've been so focused on providing good patient care that sometimes I can forget that the family's there. I'll address them and say hi to them, but I'm glad you mentioned it, because I know it's important to involve them, but it can be really challenging sometimes.
Right.
Because I just like to think about the patient and everything that's going on with them.
You emphasize patient teaching. Sometimes you need to incorporate the family in the patient teaching. The patient can't always remember what you're providing at the bedside, and they're going to be going home.
That's true.
So the family would need that information as well.
My patient from last week was a good example of that. You're right. I think, I just need to maybe broaden my perspective of who to talk to and who to teach to. That's a good point.
You've had excellent paperwork that you've submitted to me. Anything that could enhance your paperwork for the next rest of the semester?
Let's see. I'm glad to hear I'm doing well. I got the sense that you felt like it was appropriate and good. I think there's so much paperwork that a little bit of more specific feedback from you might be helpful, because it takes so much time to fill it all out, and I think if you were able to put maybe some specific notes on different portions, that might be a good point for me to improve upon.
Right, a few more details, or how it can correlate with your classroom theory a little bit better.
Yeah, that would be wonderful for me.
So, and also looking at evidence-based practice as well.
Yeah, that's something I haven't really incorporated very much, but you're right, that could be a good thing too.
So we've had discussions in class, and you've had written assignments. You need to utilize that in the clinical setting as well.
Yeah.
Digging a little further.
Yeah, you're right.
Any other areas that you'd like to strive to improve in?
Well, now that you mentioned the family interactions, I'll be focusing on that, so I'm glad that we talked about it. And critical thinking too, like I said, I know it's such an important part, and I think it takes a lot of experience to be really good at incorporating that into my everyday activities as a nurse. So maybe you and I can talk later about finding ways to improve my critical thinking, or if you're seeing me in the clinical setting doing something where I could improve upon it, that would be good.
I'd be very glad to help you on that.
Okay, thank you.